Hello and welcome to VMC. I'm Dr. M. Nice to see you back, and if you're new here, please subscribe. We are going to dive into, once we do have dental disease formed, the steps that can be taken in order to treat that dental disease. Join me. I hope you'll learn something today. Alright, so you know your pet has dental disease, you've asked your veterinarian all the questions that you've had about the expected procedure, and then your pet will go under general anesthesia. This is for their safety as well as the safety of anybody working on their mouths, because their mouths are going to be sore and we can't just ask them to sit there and go for a couple of hours while we're working in there. We need them to be unconscious so that they don't bite anybody, so that they don't swallow anything, so that we don't have them move unexpectedly, because the instruments that are used are often quite sharp and you could cause a lot of trauma or damage to the mouth if the pet moves. And because we're going under the gum line, we do need them to be staying still, and as a result, general anesthesia is a must. So your veterinarian will induce general anesthesia for your pet. Then x-rays should be taken of the whole mouth. After that, they will start to formulate a treatment plan for whatever's found on those x-rays. The veterinary nurse, that acting a lot like a hygienist in the human world, they will be scaling and polishing all the dental disease above and below the gum line, while the veterinarian is formulating the treatment plan for if there are teeth that need additional attention. We can use local blocks so that the mouth is frozen, which can help to reduce the pain for the pet significantly. And then if any extractions or root canals or gum flaps or whatever is necessary can be done with the mouth frozen and the pet under general anesthesia. Then once the treatment plan is complete, the animal will be woken up and they will be monitored until they are awake enough to be able to kind of move on their own, not be intubated anymore, and then they can just have some quiet recovery time still on their IV fluids so that we can give them pain management as they need it. And then usually pets can go home the same day. Now there could be some trauma cases or some intensive surgery cases where treatment for pain management and monitoring is required overnight. In that case, your vet clinic might be set up to do 24-hour monitoring. If not, then you might have to take your pet to a 24-hour facility for some overnight hospitalized care. That's very important. And you should also expect that if any extractions are done, that your pet will go home on appropriate pain management. This will generally include an anti-inflammatory and at least one other medication like gabapentin or an opioid type medication, depending on the severity of the dental disease. And it should be pretty uncommon that antibiotics are necessary. We have a decent amount of research that if the infection is removed from the mouth and the area that tooth was, if that area is flushed out well, then oral antibiotics post-operatively aren't generally needed. But if there was bone involvement with that, your veterinarian might also send home antibiotics for infections that were found in the mouth. If what your pet is sent home with is not enough for their pain management, you need to contact your veterinarian, go to an emergency clinic, whatever you have to do to get more pain management. Do not leave your pet painful. And I will share the videos where I've talked about dog and cat pain and their symptoms in the description below so that you can go and watch those if you haven't already. And I'm also going to link to the video where I go over the common types of pain medication used in our companion animals. Your pet might also need softened food for a while after a dental procedure. Your veterinarian might recommend canned food, or you might need to add some water to kibble and let it sit for a while so that it softens up and your pet can eat it. I would expect the mouth to take 1 to 2 weeks to be mostly healed. Usually any sutures that are used will dissolve on their own, and so you don't have to worry about having those taken out later. That would be difficult. and most pets recover really well and bounce back quickly, and I can't tell you the number of times that people have reported to me that their older dog or cat is now acting like a puppy or kitten again because they just didn't realize how much daily pain their pet had. And once that pain is removed, the animal is so much happier, and often we will see that in their day-to-day lives. You should also notice that the gums will go back to looking healthy, not red and swollen anymore, and the bad breath should also be gone after a dental treatment. What about anesthesia-free dentistry? All right, this is a pet peeve of mine and most veterinarians. Anesthesia-free dentistry must not be done. It is an awful atrocity and only serves to harm the pet. So there's a few things we need to think about here. One, we know that so much of the dental disease is below the gum line. With an anesthesia-free dental, the only thing that can be addressed is above the gum line, which is essentially cosmetic. It doesn't benefit your pet. The only thing that is being done is scaling or scraping the crown or the visible part of the tooth. Scraping that part of the tooth leaves the surface rough, and that actually predisposes it to having the bacteria sit in the scrapes that are left on the surface of the tooth. So the dental disease will build back up even more quickly. In a proper, what is called a COHAT, a comprehensive oral health assessment and treatment, that is done under general anesthesia so that we can scale the tooth, but the pet is still, so we're going to do minimal trauma to the enamel of the tooth, and then any scrapes that we have put in there, getting off the tartar and the plaque, will be buffed out when we polish the tooth, and we can get under the gum line, and so that is the only appropriate way to move forward with treating dental disease. It causes them pain while the procedure is being done, and there's no pain management, and the animal is also often frightened. The other horrific thing about these anesthesia-free services is that you think, because the mouth looks better, that there aren't any problems going on in that pet's mouth anymore. But the fact is that none of the actual issues that are causing pain or infection have been treated at all. And so I have had so many patients that finally do come to me, and then I take those x-rays in the mouth, and it is just an awful mess underneath the gum line because the issues have been going on for years and years and years without proper treatment of them, and that pet has been suffering for so long. Do not do this to your pets. It is a waste of money. It's dangerous for their health. It's scary for them, it's painful for them, there is no benefit to it. Do not do anesthesia-free dentals. Just do not do them. And in many places they are illegal because it can be considered practicing veterinary medicine without a license. And so you can report them to veterinary licensing boards if you find them. It is decidedly under the current standard of care, and it is not appropriate to be doing these at all, period. I have also had patients come to me after these procedures that actually have broken jaws because the animal is fighting, they have a painful mouth, the people aren't stopping, and the jaw ends up being broken. Do not do anesthesia-free dental procedures for your pets. Not ever. Don't do it. Thank you so much for joining me today as we talk about dental health and how to treat dental disease in our pets. I would love for you to comment down below with any questions you might have, anything that wasn't clear, or anything that you might want some more information on. Feel free to share this video and subscribe if you haven't already. Oh, please also comment if you have any future ideas for topics that you would like me to cover. I'm trying to get to the things that people have asked for first. And so if you have anything that you have questions about, comment it down below, let me know, and I'll add it to the list for future videos. All right, join me for part 2 of this series where we will discuss the prevention of dental disease, and I look forward to seeing you then. Bye.